We ready? Good to go? All right. Take a little sip of water. Good afternoon, everyone. Welcome back. I hope everyone got the chance to enjoy the long weekend and some of the beautiful weather that we have been getting. The sun is shining. It is still a little crisp out there, but brighter days ahead, I hope. At the outset of this health pandemic, we spent a great deal of time getting islanders back home safely to Prince Edward Island. Over these past recent weeks and in the next couple of weeks ahead, we have been focusing on how we can get islanders safely moving around Prince Edward Island a little bit more. And as we have been talking about carefully and methodically opening up our province, one of the areas that we have been looking at also has been the opportunity to bring our seasonal island residents back home. A big part of our communities are those who come here seasonally, who spend a season or two here each and every year. Most have strong family and community connections to this province, and they make a tremendous contribution to our social, economic, and cultural well-being. In most cases, these individuals consider Prince Edward Island home, even if they don't have the privilege or opportunity to be here year-round. And that is a very special connection for them, but also for us. And that is something that we need to really remember and embrace, particularly in these most difficult and challenging times. Starting June 1st, we will begin the process to allow for seasonal residents within Canada to return to their PEI home. The important word here is process. To begin, every seasonal resident returning to Prince Edward Island will need to self-isolate for 14 days. They will need to demonstrate they have a proper support system to adhere to the public health orders, and they will be contacted by our Operation Isolation Team. Because we are in unprecedented times, we will require seasonal residents to submit their relevant travel and property ownership documentation, as well as their self-isolation plans and other details prior to traveling to our province. This will include an online submission form, which will include names of the travelers, the permanent address they live, plus the seasonal address here in Prince Edward Island, their detailed self-isolation plan, including who and how they will be supported during their 14 days of isolation, agreement to the terms and conditions outlined within the public health order, and agree to participate in Operation Isolation, which means the continued screening and phone calls during the 14 days of isolation. We will also be providing detailed information about what self-isolation in Prince Edward Island is, which is the very same process that we've asked every returning islander to adhere to in these COVID-19 times. That means self-isolation on your property, not walking on beaches or strolling within parks. It is important to note that seasonal residents must be pre-approved for travel before arriving at the bridge or the airport. We will be starting the process for pre-approval requests on June 1st, not before. And upon successful review of the information, confirmation will be issued, and this confirmation will need to be presented at the bridge or the airport when your travel to Prince Edward Island is undertaken. Seasonal residents who attempt to arrive at the border without this confirmation will not be able to enter this province. This allows us to be open to our seasonal island residents, which I have said before is within and is the very nature of who we are as islanders. But we also have to protect and monitor the risk, which is why this process will be closely monitored by CPHO and public safety officials to ensure the well-being of all islanders. We understand that these are challenging times, and we are all learning a lot. We are doing things this year that we have never done before, and this is much different than how we have undertaken this process in the past, to state the rather obvious. But I sure hope next year things can be different again, but until then, we need to be measured and we need to be careful. So we are embarking on this long journey back, and part of the process includes learning to live with COVID-19. We've talked about that a lot at this table, but part of the process of learning to live with COVID is undertaking the actual process of learning to live with COVID, and this is just one of those steps. I also wanted to bring to your attention that in the upcoming weeks, you will see a number of campaigns launched focusing on encouraging islanders to move around the island, to support local, and to do it safely. We've seen our local suppliers and businesses come together and provide island products and services to islanders in a unique and creative manner. As a community, we need to support our local economy as much as we can. So you should be buying ADL cheese, buying local craft beer, island chocolates from Green Gables and PEI preserves, and so many more. The list is so long. But these important suppliers employ islanders. They sponsor local sports teams and help with the arts and culture growth of our community. And they help to grow PEI and our brand as islanders nationally and internationally. Our team in tourism has been working hard over the last few weeks in preparing a Staycation Campaign that will be launched June 1st. This campaign will focus on partnering with our local regional tourist operations to promote fan-favorite destinations in all areas of our province. We want islanders to see and experience everything that our province has to offer and to get a better understanding of why millions of people want to come here every year to spend time in this beautiful place that is Prince Edward Island. And in the process, we will be able to support our local economy. So instead of jumping on a plane and going to a city in this beautiful country this year, we hope that you'll hop in your car or jump on your bike and explore the many attractions we have right here in our own backyard. As I say, 1.6 million people usually visit and would do anything to come here. And this is an opportunity for us to explore our province, to create memories that will last a lifetime and help and support our friends and neighbors and fellow islanders. So with that, I'll turn it over to you, Dr. Morrison, for your daily update.
Thank you, Premier. One of my children said to me on the weekend, just one day, I don't want to talk or think about COVID. And I'm sure many of us have a similar feeling. It has impacted us in so many ways, this global pandemic. We're getting tired of the stresses for many, tired of the rules, for some tired of homeschooling, and we worry about the impacts of what has happened, what will happen. But as the Premier mentioned, and we've said here before, we are having to learn to live with COVID, and we will have to do so for many months. And as part of that same conversation, one of my other children said, I'm not afraid of COVID. We just all have to do the right thing, and everyone has to be careful. And so I think that's I thought I'd open with that those two comments, which I think are very timely. At some point in PEI, we may see more COVID-19, and that is also part of how we learn to live with COVID. But we will need to identify those cases early, isolate people, do contact tracing, and manage, as we have been doing. Because of really an enviable position that PEI is in, we are able to move ahead with relaxation of restrictions in a very cautiously optimistic manner. We continue to test broadly for COVID-19 in our province, at clinics in Charlottetown and Summerside. And it's extremely important that anyone experiencing symptoms related to COVID-19 consider getting tested and call for testing. So a new and worsening cough, shortness of breath or difficulty breathing, fever, chills, sore throat, runny nose, sneezing with congestion altogether, headache, muscle aches, unusual fatigue, acute loss of sense or smell, smell or taste. And with increased testing, we're able to do that quickly, ability to quickly identify cases of COVID-19 in the province and to do that contact tracing. And if you're not sure about your symptoms, then please call 811 or your physician or NP for testing. We had 580 new negative tests since the beginning of the weekend. And in terms of testing, we've continued to get some questions, and I want to clarify the essential worker exemptions for testing. So testing an exemption from self-isolation for those certain essential workers who are island residents who are due to the 14-day self-isolation rule would never be out of self-isolation when at home. So it is for island residents who are essential workers who come and go frequently and leave the province in less than 14 days between working assignments. And we are getting frequently asked questions and trying to clarify with some fact sheets to have for people with further questions on that area. So Friday, we move into phase 2 of the Renew PI Together plan, and it's an important opportunity to reopen our economy while continuing to be vigilant in our efforts to protect our province and islanders from COVID-19. So that includes phase 2, reopening of additional businesses and personal services, childcare services, ongoing non-urgent healthcare services, and government services. And we've certainly been working on a number of those guidance documents, and I'll mention those briefly in a minute. While more businesses and services can reopen their doors to islanders starting on Friday, they also can choose to wait until a later time that is more convenient or more comfortable for them. All businesses and organizations are reminded to complete their pandemic operating plan, outlining the adjustments they're making to align with public health measures before they reopen. And for phase 2, the limits for gatherings will not change. Individual households will still be allowed up to having 5 additional people in their home at one time and up to 10 additional people when gathering outside. It's extremely important that individuals still need to maintain physical distancing when getting together with people from outside your household. And I have received emails and concerns. My children, again, seem alarmed at the number of people who aren't practicing physical distancing. We need to get used to it, practice it, and it will protect us as we go forward in the months ahead. It's on Monday, June 1st, that phase 3 will begin, and that's where we have some larger indoor and outdoor personal gatherings, and we'll speak more about that in the days ahead. But that's where they'll be reintroducing more organized recreational activities, facilities, and services on June the 1st. That will also include the restaurants. We've had a number of questions that also will include playgrounds. And I know that is being anxiously awaited by many. We are continuing to provide guidance and have been working with various sectors as well. So the retail guidance is on the website. Our campground guidance should be going up, as well as fitness facility guidelines, and the restaurant guidance also should be available within the next day if it's not already on the website. Long-term care visitor restrictions, I know we've talked about that, and they are being looked at, and we expect more details by the end of the week. I became the Chief Public Health Officer here in Prince Edward Island back in 2007 and have worked with various governments and people and departments, and came here with a strong interest and passion for public health and protecting the population of this province. It's my home province that, like so many, we love dearly. And of course, I knew there would be challenges and surprises, but the COVID-19 pandemic has been a situation where it has probably been the big challenge for our office, for me. We have all learned along the way. And every decision that goes into the management of the COVID-19 pandemic is in the best interest of all islanders. And recognize that these decisions sometimes are really difficult and they impact us all in different ways. As we ease restrictions, it is too fast for some, and I know the Premier said this as well, it's too fast for some and too slow for others. but we are trying to make decisions the best we can, as carefully and cautiously as we can. It has, and it is about protecting us, protecting each other, and protecting our entire population. It feels like some of these things we're going through will be forever. It won't be forever. And we sometimes get caught up in thinking about what we can't do, or what our society feels like with physical distancing. But let's try to think about what we can do. Let's look forward to doing many more things in the weeks ahead. But let's look forward to doing it a little differently and carefully. As we work through these phases in renewing our province, I want to thank everyone for their patience and understanding. Let us continue to be understanding. Let us continue to be caring, and let us continue to be kind. Thank you.
Thank you, and good afternoon, everyone. Our focus at Health PEI remains on ensuring we're prepared for any surge in COVID-19 cases while continuing to carefully reinstate the health services Islanders need. Our separate services reinstatement team is evaluating the services that will be reintroduced, and we'll be looking at how those services may impact our ability to respond if there were to be an outbreak on Prince Edward Island. We too are being cautious in our approach to ensure our system is there as a safety net should we need it. Our response is working in tandem with the phased approach of Renew PEI Together, with a focus on balancing what services can be safely reintroduced while maintaining our capacity for any cases should we see them. We are seeing fewer patients on weekends at our cough and fever clinics, drive-through testing clinics that have been running for many weeks now. So we are making a small change to the hours of our clinics in Charlottetown and Summerside. Moving forward, one of each of these clinics will be closed on either a Saturday or Sunday, rotating each week so that Islanders will still be able to have access 7 days a week to these clinics should they need them. And we will adjust that if we see the numbers increase. That team from our primary health care services and family physicians and nurse practitioners have been working a long time to make these services available. So we're hoping this adjustment will support their need for some well-deserved rest as well. Yesterday, we saw 63 patients at our Charlottetown clinic and 18 at our Summerside clinics. A reminder that anyone who has the symptoms, as Dr. Morrison mentioned, to please contact your family doctor or nurse practitioner or call 811 for an appointment at the cough and fever clinic, and those appointments are available the same day or the next day. When arriving at the clinics, please remain in your vehicles until notified otherwise by staff on the site. And also remember that our emergency services continue to be there and to be offered for you. Call ahead for appointments so you understand the process for your admitting or intake at your clinic, but please attend your appointments that are scheduled for you. And call 911 or visit a near emergency department if you have an emergent health issue. Thank you.
Thank you very much, both of you. And we will now ask our friends in the media to offer some questions.
Nicole Williams, CBC.
Hello, everyone. My question is for both Dr. Morrison and Premier King. I think a lot of people are concerned about the decision behind allowing seasonal residents here, and I know that it's been mentioned in these briefings that the biggest risk to PEI is the importation of cases. So I guess I'm just wondering why the decision to open PEI's borders to seasonal residents.
Well, I can start if you want, Dr. Morrison. And thank you, Nicole, for the question. And I guess, not one decision that we've made here in these past 8 or 9 weeks has been easy. I think if we only made the easy decisions, we might only need to work about 20 minutes a week. It is a difficult decision. The first question I asked Dr. Morrison most days when we discuss our plans to reopen, can we do this carefully and can we manage this from a health perspective? And that goes into every decision, as Dr. Morrison just articulated. That goes into every decision that we try to make here. The biggest part of this would be the self-isolation. I mean, we've had people coming in and out of the province for the last number of weeks that have been adhering to the self-isolation for 14 days, and that will remain very, very important. And certainly is a big component of this. So the onus will be on us to make sure we monitor that, but also those seasonal island residents who are coming here to get back to their PEI home. I would say, quite honestly, that there's always risk. I mean, Dr. Morrison talks about this every day. Part of the process to learn to live with this is the understanding that there is daily risk of seeing more COVID come here. But we do have to learn to live with that. But we do feel, as of today, that we have the ability to manage this from a public health perspective, but we also have that ability to pull back quickly if need be.
And Dr. Morrison, I don't know if you want to answer that as well, just about why.
I mean, I think the Premier answered it well, and I think it will. Our testing will continue to be important. The self-isolation will continue to be really important. We certainly have learned that islanders will help in making sure visitors have or not visitors, but seasonal residents have the supports they need to self-isolate, and certainly will let us know if they aren't. I think we look at, a number of our seasonal residents are from even Nova Scotia and New Brunswick, and we're watching carefully what numbers are and what the situation for COVID-19 is in both of those two provinces. What we're also looking at is what is happening with COVID-19 in terms of the cases and the number of cases that are considered recovered in the rest of the country as well. So I think it's trying to balance. And one of the words we haven't always used here, it's about having to be nimble. And it's not a word that is used frequently in health, but I think we will need to be nimble at changing things if we're worried and if things change around us. And that will mean that the restrictions will be put back in place, and that would be very much the case. It will, it's about how we respond quickly to any changes. So I think, yes, we're concerned, but we also are knowing we have to, that there's not an end in sight immediately to this. So we're going to have to try to manage.
Thank you. And I guess my second question is, can you just be a little bit more specific about what goes into the pre-approval process for these seasonal residents? What are you looking at for in terms of the criteria?
Well, essentially, it's not. We want to make sure that, first of all, that who they are and that their information matches up with that which we have here. But more important to that would be knowing that they have a responsibility to have a 14-day self-isolation plan and a support system to make sure they have the provisions they would need for that time. That is really essentially what we're getting at. And when I talk about doing it a little bit differently, we're trying to manage this in a way so that our officials with CPHO and public safety can effectively manage the arrival of these individuals who are so important to the social, economic, and cultural component of Prince Edward Island. We just want to make sure there's a manageable process for this. We want to make sure they are who they say they are, and to let them know what their responsibility will be. Like all Islanders have embraced, we're going to expect them to embrace the same process.
Thank you.
Louise Martin, CBC. Oh, good afternoon. This question is for Dr. Morrison, please. We're working on a story today on home daycare operators, and a lot of parents questioning how safe it will be to operate with 7 kids plus other family members, particularly when they haven't been given any clear safety protocols as licensed centers have. How do we address it, or how do you address those concerns, and why haven't they been given many protocols to follow at this point?
Hi, Louise. So I believe most of the communication with the both unlicensed and licensed daycares are through early childhood and education. And my understanding is that the guidance has gone out from early childhood, and they have been addressing many of the questions. And so if there's more guidance that is needed, certainly I'm happy to take that back. I haven't certainly been asked by early childhood for today for that kind of additional, and really whether for so many of for the daycares, it's similar guidance to what was being given really for the child care centers that have been up and running already. It's about trying to minimize risk, making sure children are not sick when they come into the daycare. And so I'm sure we can get further answers for that, but more than just answers, make sure if home care or the unlicensed child care are wanting more information, then we can do all sorts of things to help with that if it hasn't already been done. So we've previously participated, I know our office, in those sort of town halls, teleconference, sessions for those who were doing the daycares for essential workers, for instance, so there were a large number of those operators. We've done certainly participated in the guidance that developed for them. So if there's a need to look at more, we're happy to do so.
Thanks very much. My other question is about the new modeling numbers that are now available online. I believe they were put up on Friday, and they show that certain restrictions will be in place into next year, so into 2021. Can you be specific about what those restrictions are and how these new projections impact any decision making going forward?
So we've talked about the fact that models are just one tool of many that are used, and in the modeling scenarios that were looked at most recently, it looked at how our capacity in the health system would be impacted if you have just a gradual release, which is really what we're doing, and good adherence to public health measures and monitoring. So if we did that with, then we would be able to manage any potential increase in COVID cases here without overwhelming our system. But it also shows that if we had to put certain, if the indicators would suggest that we need to, with more of a surge, we could clamp down again, and it would make a difference, and it would impact the resources that would be needed. So it's really looking at, if we went from a small percentage of contacts that we are having right now. So we went from not having our normal amount of contact with each other, and if we all of a sudden had a lot of contact, back to our normal amount of contact every day, that would be too much for our system to handle, because it would increase the risk of COVID over our capacity to manage it. But if we really do our release slowly and gradually, which is what we're doing, and we're monitoring it, then our system would be able to handle an impact or a certain number of COVID-19 cases. Again, just reinforcing that we're on the right track. We're doing what we're supposed to do, not wanting to just turn on a switch and go back to normal all of a sudden. And so again, modeling just one more tool, and we will continue to look at that going forward. And many thanks to the whole modeling team that has been involved with that work.
Thank you so much. I appreciate it.
Julien Lecachon, Radio-Canada.
Hi, both. Question for you, Premier. The situation is a little bit complicated between PEI and the Magdalene Island for the past couple of days and maybe weeks now. It's difficult, to really understand what's happening, I need today, Premier, some clarification exactly on the situation. Who is allowed to cross New Brunswick and PEI to go to the boat at Surrey? Who is delivering the authorization to the person from Quebec or the Magdalene people to travel and to cross the both provinces? And can you confirm that if the people who are not residents in the Magdalene Island, but they have, a second property on the island, they are allowed to cross both provinces to go to the boat?
Well, thank you, Julian. There's a lot wrapped up into that question, but currently the traffic traveling to the Magdalene Islands through the ferry in Surrey, Prince Edward Island, is for essential travel. Those who are traveling to the province of Quebec need to have a letter of authorization from the province of Quebec to say what they're doing there, and that will continue for the time being. I think, like every other province, Quebec are trying to find the best ways to allow some of their seasonal residents to get back to enjoy parts of their province as well. I'm not familiar today with what their exact process has been, but I've been in contact with the Premier of New Brunswick and also with Premier Legault, and certainly told them both that we wanted to make sure we were extending the same services to our own seasonal residents that we would be expecting others to do so. So I would expect that the process with the Magdalene Islands will continue for the time being, and those who would be traveling through Prince Edward Island to get there would need to have a demonstration of their essential nature from the province of Quebec.
My follow-up on this, Premier. Can you confirm that some discussion already began between you, Quebec, and New Brunswick about to let some tourists to cross New Brunswick and PEI to the Magdalenes after June 15th?
I can't confirm that, no.
No, you can't?
We haven't had a conversation about tourists at all, no.
Thank you so much.
Thank you, Juliet. Merci.
Rachel Collier, Eastern Graphic.
Hi, I'm hoping Dr. Morrison can provide a bit of clarification about what warrants a fine under the Public Health Acts and Orders. Specifically, can people be fined for not physically distancing? And can people be fined for not following a workplace operational plan?
So, hi, Rachel. I'll answer the second part first. So, if for the operational order, the answer is yes. We expect first it'll be an educational approach, and we always talk about a balanced use of authority, and we would like it to be about education first. But yes, businesses could be fined if they don't have an operational plan in place, for instance, and in those cases, they could be potentially putting a group of people who come to their businesses or their staff at risk. And there is a fine structure laid out in the Act. In terms of the physical distancing, we have talked about it. We have told people now, feel like every single day almost, it is about the importance of physical distancing. It is based on what we have learned to date about the virus in terms of how it's spread. It is a very difficult thing to put that in an order to enforce, because people move, and if by the time anyone gets to someone who may not be physically distant from each other, it's a very challenging part, and we recognize that there are other ways and other parts of our order that are we are able to enforce in a different way. Mass gathering numbers, that's easier to deal with. But we know it's in part of our policies. We know physical distancing, restaurants will have to have a certain distance between tables, for instance. So it is captured in other ways of having that 6-foot distance. But it's important that we continue to talk about it. You hear about it, certainly all media have talked about it, and we will continue to hear about it, but it's like hand washing, very, very important. But we don't have hand washing in an order, because we expect people to do that, and we recommend it. We try to tell people how important it is to reduce the spread of a virus, not just for COVID, but for influenza, for instance, as well.
Okay. And I guess the second thing I had to ask is another just bit of clarification. Many islanders seem to suspect they had COVID-19 before the first cases were confirmed on PEI. Some say they think that they might have had it even as early as February. And I'm just wondering what you might have to say about this. Is it possible, and what kind of informs your answer?
Well, I mean, we're watching certainly what was happening with COVID-19. I think one of the first meetings I had about Wuhan and the virus was before the middle of January or near the middle of January. So we have been monitoring what was going on across the country and the importation really of COVID-19 and the pandemic into this country. We know that the cases really were associated with travel initially into the country right from the first case on. Is it possible? I think in the months ahead, as we explore serology testing and serology of the blood tests, we may be able to determine if people have had exposure to the virus. At this point in time, it's difficult to know whether those serology tests, even if you've had exposure, if that produces immunity or protection. And so that's why there's lots of work being done in that area, and we'll continue to see that. So it's also possible in January and February, there were a lot, we still had influenza circulating in our province and many other viruses. So it's hard to know, and it will be difficult to tell at this particular time unless we get some serology tests in the future.
Thanks so much.
Allison Jenkins, The Guardian. Allison Jenkins, The Guardian.
Oh, yes, hello, sorry. Just me again here on my complaints line, my usual question there. Wondering about if there's enough people working on answering complaints. I guess just looking for the latest. Have there been an increase and whatnot? I saw a tweet that someone was picked up at a supermarket who had been not isolated after returning to the province. So just looking for, has there been an uptick in that as things loosen? Not so much. Yeah, has there been an uptick in numbers since restrictions have eased?
Hi, Allison. So I don't have the numbers in front of me in terms of the enforcement numbers. I did see them, I think, yesterday. I certainly it wasn't brought to my attention as a huge increase in numbers, but we can certainly provide those to you directly afterwards, or I can speak to them on Friday, one or the other.
Okay, yeah, that would be great. And my second question would be about some upcoming serology testing. Have you looked into any, specific tests or kits that you'll be using, or have you started on it? What's the scoop? It's very exciting.
So there are, as of the end of last week, there are 2 serology tests that have been approved in this country. And we will be discussing, it may even be this afternoon, what that could look like for Prince Edward Island and what that could mean in terms of numbers. And we are having quite a bit of discussion nationally because this is really important from a national point of view. There's what we call an immunity task force that is being set up. PEI will have a representative, someone from my office on that, to look at what these serology tests actually mean. And as I mentioned before, exposure, what does that really mean in terms of immunity? What can we learn about the virus and the extent of its impact on our population? And they're looking at this, both Dr. Tam federally, working with the provinces. So it's something we're following and we'll continue to monitor. We're involved in those discussions nationally, and we'll be having those discussions here locally as well.
Okay, thank you so much.
François Dufour, Radio-Canada.
Good afternoon to you all. Ma question serait en français pour Dr. Morrison. Pourriez-vous m'expliquer en français les raisons, les motivations derrière la décision aujourd'hui de permettre aux résidents secondaires, les propriétaires de chalets de l'île du Prince-Édouard, de pouvoir venir dans la province à partir du 1er juin? Qu'est-ce qui motive ça et quels sont aussi les risques que vous avez étudiés dans la prise de cette décision-là?
Bonjour. Alors, le Premier ministre vient d'annoncer qu'on commence un processus pour les résidents de l'été. Et il faut qu'il y ait un plan d'auto-isoler ici à l'île du Prince-Édouard. Ils vont être donné l'info à propos de où ils vont habiter ici à l'île du Prince-Édouard. Je sais, le Premier ministre a bien expliqué en anglais que c'est les résidents qui ont vraiment, ils pensent que l'île du Prince-Édouard est vraiment aussi leur province. C'est pas seulement aux insulaires. Et puis, pour moi, c'est de regarder l'importance d'auto-isoler, de faire les appels, que le bureau peut faire les appels, les insulaires et les autres doivent les supporter pour qu'ils restent auto-isolés. On regarde aussi la capacité toujours du système de santé pour que, si on a les cas, on a la capacité du système. On regarde le nombre des cas au Nouveau-Brunswick, la Nouvelle-Écosse, les autres provinces du Canada. Et puis, oui, il y a un risque, mais je pense que c'est balancé. Et puis, si on peut s'assurer qu'ils auto-isolent et puis ils ne font... et on pense aux insulaires parce qu'on veut les protéger. Et je sais que les personnes qui viennent ici pour l'été, ils vont aussi veut protéger les insulaires. Alors, j'espère que tout va bien aller.
Un suivi par rapport à ça, si possible, Dr. Morrison. Pour ce qui est des propriétaires de résidences secondaires ici qui sont des Américains, qui viennent des États-Unis, est-ce qu'il y a des discussions à savoir si ces personnes-là vont être autorisées à venir à l'île dans le courant de l'été?
À ce moment, je comprends que entre le Canada et les États-Unis, ils ne sont pas permis d'entrer à ce moment jusqu'au 26 juin, je pense. Alors, on va voir qu'est-ce qui arrive à propos des personnes qui habitent aux États-Unis à ce moment. Mais maintenant, il ne peut pas entrer à cause des règlements entre le Canada et les États-Unis.
Merci beaucoup.
OK, merci.
Laurent Rigaud, la voix acadienne.
Laurent,
Good afternoon.
Laurent, juste, s'il vous plaît, je vais juste répondre en anglais parce que je pense que c'est quelque chose que vous avez mentionné en anglais. The last question was a question around American seasonal property owners, and I just wanted to, my understanding, Premier, is that the Canada-U.S. border is still closed to except for essential travel, so that at this point in time, the American seasonal tourists are not part of the process that you discussed.
Yes, and so June 26th is the date in which they would look at lifting the U.S. border. And just, Francois, for further clarification, we have about 3,500 seasonal residents, property owners, and about 1,200 of those would be international, which would include the United States. So the Canadian seasonal residents ownership would be about 2,300. So it's about 1,150 would be U.S. and then another 50 from around the world. So, merci.
Thank you, Premier.
Bonjour, Laurent.
Yeah, I will ask my question in English because it's for both of you. Bonjour. Speaking to seasonal residents which cannot come today, when they ask questions on social media, they have some mean, I would say, comments from islanders, and some have said to me that, I quote, "This is not the island we know." What can you say, Premier, to the islanders to, tell them that they have to understand that someone who has a residence for 5 months on the island can come?
Well, thank you, Laurent. Look, we know, having been doing this for the last 10 weeks, that a number of things we know, that islanders are very, very engaged in the day-to-day operations of life in PEI since COVID. We know a lot of people have opinions on things, and one of the great privileges of being the Premier of PEI is people have a very open sense of sharing that, and it's and mostly that is good. I think there are some comments that have been circulating that I don't think come from a place of meanness. I think that there's a lot of unknown about this virus, and a lot of people are concerned, and when people get concerned, they get afraid. And as I said here last week, that sometimes anger is a very close cousin to fear. And so we understand that. We understand that people have varying viewpoints on this, but at the same time, these seasonal island residents are very, very closely connected to family and communities here. Many of them are islanders who have moved away, who are keeping a close attachment to this province. I did point out last week that I thought there was some comments on social media and that have been circulating that have been not the best of who we are as islanders, but I do think overall islanders have remained to be very open, very caring and very trusting and very eager to try to get back to some kind of normal. But we do live in a world where people have the ability through social media and otherwise to share their opinions, and sometimes those opinions can be, dare I say, a little bit unkind.
Okay, thank you. And I just have a follow-up regarding the previous questions from Francois. So if the border between the US and Canada is not, does not reopen on the 26th of June, what will happen regarding all those residents who pay taxes on the island and they cannot come?
Yeah, look, that's obviously a question that I don't think we can accurately answer today. I would think that once we get into, if the border doesn't open on June 26th and it would be extended longer, then we're getting into a situation where it would be very realistic that most or all of those individuals who want to get back here to Prince Edward Island might not be able to get back here. So we haven't really been to come up with a fair answer on that question just yet. We have been working with Dr. Morrison to make sure we could begin the process to get some Canadian seasonal residents back here. And that's what we're prepared to look at beginning on June 1st. But like many of these questions, Laurent, they're very good and they're very important questions, but COVID has made it difficult to have the answers provided just yet. But we certainly hope the answers will come in the days ahead.
Thank you very much.
Merci. Well, thank you very much to our friends in the media as always, and I appreciate your comments and questions, and keep up the good work. So have a good day.